Samir Desai, Chris Belcher, and Blake Davidson. I want to hear your opinions. When you have a student who's applying for your program, and you have that conversation about what kind of program do you want to go to, a 3 or 4 year program, how do you usually have that conversation with them?
I guess I'll start out. I think the first thing I usually like to hear is what their goals for after residency are going to be. That can kind of help guide the conversation. Also, if they have specific interests, such as certain subspecialties within emergency medicine, that can really make a big difference in kind of how I would advise that student.
What has been the general consensus about the length of training?
So I think you're getting impassioned discussion and debate from both sides. And coming from 3-year programs, we feel that we can make a competent emergency physician in 3 years, but we can also do better.
What's your opinion on part of the preamble that I gave talked about seeing fewer patients? Is that borne out in the data? Are you able to track that?
Objectively, I've been tracking our residence volumes over the last 3-4 years, and there has been a slight downward trend in the total volume. And I think the way I want to first clarify that is it's not that I think our residents are working less hard. I think they're being asked to see less patients but do more for those patients.
Chris, earlier you mentioned that when you were at the program director conference that there were a lot of very passionate people on the 3-year side making arguments. What were some of those arguments?
There was a study a few years back that looked at, board pass rates and things for 3-year versus 4-year programs, and there was no difference. And so they wanted data to back up these changes. And it's just not there because this task force has planned the emergency medicine of the future. It's also a financial argument, both from the resident perspective and from a GME perspective, because it takes a lot of money to train a resident, and where are we going to get that money from to have another year? So there's a lot of people that are going to have to shrink their programs, or in some cases, programs may go away because of these changes. And so that's a real potential issue and an argument that these 3-year proponents have made.